Hello, I'm Dr. Mark Gittleman from Uromedics 21C and Optimal Health Miami. And today I'm going to review for you how to do an injection of testosterone. Many of you may already know how to give an injection. For example, you've had to give insulin or allergy injections to yourself or maybe a family member, so you might be familiar with this process. But testosterone's a little different as it's dissolved in an oil base, whereas most other medications are dissolved in water. It is not temperature sensitive, so there's no need to place the vial in the refrigerator. And in fact, it's best to not place it in the refrigerator as it does not prolong the expiration date. And in fact, it makes it a bit thicker and more difficult to inject. You will have received needles, syringes, and alcohol pads either directly from the pharmacy with your monthly allocation of hormones and supplements, or you may have received them from a team member of Optimal Health Miami. To simplify things, I recommend that when it's time for injection, that you take out only one of the syringes, one of the needles used to draw up the testosterone, that will be 21 gauge or similar, one of the needles to inject, that's 27 gauge or similar, the bottle of testosterone, and 2 alcohol pads. To better clarify the needle sizes, it sounds backwards, but the lower number gauge is actually bigger than the higher number gauge. So it's not a mistake we're using the 21 gauge or similar when we draw up the medicine, since we want a larger needle. And then to inject, we want to use the smallest needle. That will be a 27 gauge or similar. I use the term or similar because depending on which pharmacy I select for you, you might receive slightly different sizing. If the bottle of testosterone is new, you'll need to pop the plastic cap off of the top before being able to draw up from the bottle. Use one of the alcohol pads to wipe off the surface of the top of the bottle 3 times. Place the bottle down, and now take the syringe out of the plastic wrapping and the 21 gauge or similar out of the plastic wrapping, and connect the needle to the syringe with a slight turn in a screw-like fashion. Be sure it's firmly but not tightly in place, as you're going to need to unscrew it at some point. Take the cap off the needle and turn the bottle of testosterone upside down and pierce the center of the rubber stopper with the needle. The pharmacy label makes it a bit challenging to see the level of the liquid in the bottle. Therefore, slowly rotate the bottle so that you can see your needle is in the level of the liquid. Make sure the needle is in the liquid portion of the bottle, which is still upside down, and now extract exactly the dosing that I've personalized for you. That may not always coincide with what's written on the bottle or on the box from the pharmacy. If you are unsure of the dose, take a look at the patient instruction form. That's the form that one of the Optimal Health Miami team members has written out for you at your last visit. This will reflect my dosing selection for you. While you're extracting, pull back a bit beyond the dose prescribed. Let the barrel of the syringe fill up, and then push back the excess into the bottle so that the top of the black plunger is exactly the dose that I have selected for you. The syringe you will receive is always a 1 cc syringe, so it's very easy for me to titrate your dosing up or down with great accuracy. Now, pull the syringe out of the bottle and carefully recap the needle with the plastic top that it came with. Take the smaller needle from the plastic wrapper, remove the capped needle that you used to draw up the medication with a slight twisting screw-like motion. So you're taking off the older needle that you used to pull from the bottle, and now you're going to put the very small needle on. Be sure it is on very firmly. Now you are ready to inject. There are 3 potential locations for injecting testosterone. You may inject in your thigh or your buttocks, or actually the subcutaneous fat in the region of your tummy. They will all work. So just choose the location that works best for you in terms of convenience of the actual injection as well as comfort of the injection. The 2 most popular by far are the thigh and the tummy fat. For injecting the thigh, it's best to select an area that's 1/2 way down from the waist to the knee, and you'll inject either on the top of the thigh or on the outside side of the thigh, either on the right or the left leg, but always on the outside side, never the inside side of the thigh. Use the other alcohol pad to prepare the skin. Prepare a wide area, and in that way you don't have to be as exact where the needle goes. There is no need to pinch the skin when the injection will be made in either the thigh or the buttocks. Now, hold the syringe like a dart so that your fingers and thumb are on the barrel, not with your thumb on the plunger. Remove the cap and plunge the entire length of the needle into the muscle. At that point, you can move your thumb up to the plunger and use it to inject the medicines so that the entire amount of medication is injected from the syringe. After the injection is complete, remove the syringe and needle and use one or both of the alcohol pads to gently but firmly massage the area of the injection with wide strokes up and down, approximately 20 or 30 times. This helps to disperse the medication in your muscle. Then place the needles, but not the syringe, into the biological red safety box. When the red container is full, you can dispose of it by bringing it to any of the standard pharmacies, CVS, Walgreens, etc., or by bringing it to us at OHM during one of your visits. The process is exactly the same if you're injecting into the subcutaneous tummy fat. The only thing that changes is the location of the injection. Use your non-dominant hand, meaning your left hand if you're a righty, to pinch an inch or two of the tummy fat, but not in the middle. Pinch toward the side, as it'll be easier to pinch an inch or two. Then use the alcohol swab and make the injection exactly as I've just described. For the tummy fat, there's no need to rub the area afterward. It's a super easy area to reach and very easy to tolerate. I'd say 90% of folks do just fine with this approach, but in about 10% of people, they might notice a day or two after the injection, the area gets what I call lumpy bumpy, and it's uncomfortable for a day or two. If that's a bother for you, then it's better to change over to the thigh or the buttocks. If you choose to inject in the buttocks, the process is exactly the same. If you're thin, this will be easier. Regardless of your body build, you might want to use a mirror to help you with this. The location of the injection is what we call upper outer quadrant of the buttocks. What we mean by that is when you look at the buttocks cheek and divide by 4, there's an upper and a lower area, and there's an inner and an outer area. The place to inject is the upper outer section. That is the area to inject your testosterone. If you still feel like you'd like individual instruction, our staff at Optimal Health Miami will make an appointment for you to go over individual instructions and training for you. Our goal at Optimal Health Miami is to liberate you from coming to our office. Almost all of our patients are eventually able to inject themselves. Of course, we always have the option for me to prescribe a long-term injectable, or I can place a testosterone pellet injection in the office that will last for 3 or 4 months. We can discuss this option at your next visit if you'd like to consider this option. I hope this instructional has been helpful for you. Either way, our team at Optimal Health Miami is always happy to answer any questions you may have, either today or from home, via text, email, or phone. Our goal is to make you proficient with your injections. Once you're comfortable with injections, you'll be that much more likely to increase the chance of success in achieving your personal goals.